Hello, good people. I trust you are well. Thank you for tuning in to Amanda's show. My name is Amanda Mbozenzi. I'm glad to have you. If you have not subscribed, please hit the button. And today we have a very special guest. Guess who? A urologist in the house. So help me welcome Dr.
Dr. Wanjiru Karimi. Hi, Amanda. Hi.
How are you?
Very well, very well.
Thank you for having me.
Oh, you're welcome.
Yes. Can you introduce yourself?
So, my name is Dr. Wanjiru Karimi. I am a urologist, board certified, practicing both in Thika, Kiambu County, and in Nairobi.
Oh.
Yeah, very passionate about uro-oncology, and I kind of found my way also in andrology. So here I am.
Wow.
Yeah.
Nice. Okay, so I know there is this mentality that men cannot be infertile.
Yeah.
Especially in Africa.
Exactly.
Yeah. So can you take us through what is infertility for men?
Okay.
Yes.
So you've just mentioned it, and I think it just crossed my mind that there's actually a book by Joan Tatia that talks about confessions of Nairobi men. And the first story is about a man who could not get children.
Oh.
He had 3 children who are not his. Well, it ended up in a really sad way because the lady, after, he found out that the children are not his, decided to commit suicide. But again, this is not a book club.
Wow.
What I'm trying to drive at is, when I think about it, or when I read the book, I was like, what if he was infertile? And what if the wife just wanted to, maintain a good family setup and decided to provide children for him so that it would be okay? So when we talk about male infertility, it's really such a, huge topic and a bone in everyone. Because we are Black,
Yes.
Everywhere. I think even within 1 year of getting married, the next thing that parents start telling you is, where are the children? Anakuja lini? Nasimko, kwani mnatupatia tushosho lini? See such conversations.
Yeah.
And I kind of found them really insensitive with time because what happens is that you don't quite know what is happening behind the scenes when it comes to couples and trying to get children.
Yeah.
So I will again, male infertility, which is what I want to now describe, is when a couple fail to get a child within 12 months when they are having continuous unprotected sex. Penetrative sex. So you see, there are 3 things. One, it has to be continuous or over time, frequent sex.
Yes.
And then it has to be penetrative, and neither of them should be on any form of contraception. Yeah. So, what happens then? It's a year. It cannot be within 3 months, because within 3 months, there's a lot of learning that we have to do for even couples.
Yes.
We try to find out how is the lady's menstrual cycle. How often do you have sex? Is it penetrative? Do you have a calendar? Are you having sex during ovulation for the woman? Yeah.
Okay.
So, and that is one way. So the only way that we can define infertility, which can be either main infertility or subfertility.
Okay.
So subfertility is when we have a couple that has previously been able to conceive, and then now they struggle being able to conceive later on.
Okay.
Yeah, so that's subfertility. At least, when those clients come, we are not starting all the way from the root cause. So another way that, men can find out that they are infertile, other than them just not being able to get a child, or how I've also been able to pick it up in some clients, is that they have really reduced volume of semen, or they say it's too watery. So there's a
How
certain,
do they know that?
how do they know? I think with time, because semen after a while should actually clot. So once it fails to clot, I think it raises questions with the man. Why does my semen look like this? And then that way, that's how they end up coming to see me.
Oh, so they are able to see. They are able to tell this is becoming watery and this is
too thick. Yes.
Oh,
yeah.
Okay.
Yeah. So another thing about male infertility that I'd like us to address is that it is both male and female.
Okay.
They are they are involved in it. It's a 50-50 thing. It could either be the woman or it could either be the man. We live in a society where most times we are always thinking that it's a woman,
Yeah.
hey, what are you not doing? Why are you not giving us a child? But at that point, it can also be a man. And therefore, we really delay diagnosis of finding out why can't a couple conceive a child. And one of the ways that I'd really like to encourage people is that when you are unable to conceive, investigating the man is the easiest. It's the easiest, it's the cheapest.
Oh, than the woman.
Than the woman. Yeah, I think maybe if you were to talk to our gynaes, they would take you through a plethora of investigations that they run. But the first investigation here as urologists that we do on the man is just asking for simple semen analysis. Because that way it will be able to show us a lot of things. So I would encourage, if you're a couple that has been trying to conceive, investigate the man first, get him out of the way, and then now if he's okay, then let us investigate the woman. But if he has a challenge, at least we can try address that, and also from the woman's side.
Okay.
Yeah.
And what are the main causes of the infertility in men?
Oh, so again, Amanda. One of my longest consultations is always for a man who's suffering from male infertility. Why? Because we have to get to the root cause. I will first start with your age. When did you start having sex? How often are you having sex? It really opens up a patient. Yeah. What do you do for a living? Do you smoke? Do you take alcohol? Do you exercise? Are you obese? All these things count. So when it comes to male infertility, I'd like us to know that sperm is produced in the testes.
Yes.
Yeah. So if you have an issue with the testes, then you are also at risk of getting infertility.
Okay.
So what issues are these that we'd like to address in the testes? Ideally, and as God was making men, the testes are usually formed at the back, right up here. And then right before they're born, the testes should come down and fall inside the scrotum. Failure to do so, in medical terms, is called cryptorchidism, or for my viewers or your viewers, it's undescended testes. Yeah.
Okay.
So if this is not picked up in childhood, and we like addressing it from around 6 months, with a maximum of 1 year, 1.5 of birth, then it will pose challenges in future. So again, this is to the mothers and also the fathers of boys. When you're examining your child, or take them even to a pediatrician, once they give birth, don't just assume the baby is okay. Let them go to a pediatrician, let them have a thorough clinical examination to make sure that the testes are inside the scrotum. Because failure to that, and God is wow. He's wow, yeah, because he decided, I want testes to not be in a hot area, and that's why testes are outside the man's body. Ovaries, which are, well, the female version of testes, are usually inside. Yeah, so we need a cooler temperature, and that's why God put them outside. Another risk factor is when we have something called a varicocele. A varicocele is a distended blood vessel of the blood vessel that should be taking blood back up. Remember, the testes were formed here. So meaning the blood supply comes all the way from up here. So blood should be moving back from the scrotum to posteriorly near the kidneys, where the kidneys are. So sometimes that blood vessel or that channel is not taking blood back up. And what do you have? You have the blood staying and pooling where the scrotum is, which now, well, disrupts the temperature or the environment of the testes, and it's not a good environment for sperm to be produced.
Okay.
However,
and on that, do they swell or something, or they're just normal?
Well, they're normal, but what you feel, or what we find men saying, is that I can feel there's a rubbery, warm-like, painless, rubbery thing inside the scrotum. And then now there's a way that we investigate that, and we do ultrasound, and we also grade it. Now, I don't want to raise alarms with our viewers. The grading is really, really important. Don't think that your doctor who's not addressing a grade 1 or 2 or even 3 is not giving you the best management, because we don't always do surgeries on all varicocele.
Okay.
Okay. So another risk factor is when you have an infection. Amanda, look at our society right now. I think people fear pregnancy more than they fear STDs and even HIV. Yeah?
Yes.
And you see, STDs have a risk of, once the infection is done, the healing process blocks the pathway where the sperm is being produced. So when that is blocked, that means the sperm cannot get out.
Yes.
And that is also another cause of male infertility. So that one is an obstructive form. Yeah. If you were to investigate the testis, we will probably find sperm, but you are not producing sperm. Remember I mentioned the liquid? Yes. So now in those patients, you'll find that they have the fluid. It's really watery, but the fluid does not have sperm, and sperm is what is important in conception. So that can also be a cause, an infection, which now causes an obstruction.
Okay.
Yeah. What else? Oh yeah, there are really many of male infertility. There's also genetic abnormalities. Like we find people whose sperm and a woman's ova, they just don't mix. So then every time you try to conceive, it does not progress to form a baby. And that's usually a really challenging form of male infertility.
And that one, okay, I know maybe the other ones will come back on them and on the cure. That one, the genetic, it is incurable.
Yes.
Wow.
It's really bad. Maybe science try to genetically modify, but again, are we playing with God when we genetically modify things? No. So it's not allowed. It's possible, but it's not allowed within the confines of science when you genetically try to modify something. So the couples really need a lot of counseling, the ones who have genetic abnormalities when it comes to conception.
And even for the IVF, it can't work for them?
No.
Wow.
Because IVF is just someone taking a sperm, someone taking an ova, an egg, mixing them up, boom, and then once that zygote or baby is formed, they put it now inside the womb. Yeah. So that boom does not happen for them. Yeah, it's never quite a boom.
Right. Okay. So they should go for counseling.
Counseling is important for us to know the root cause. And that's why we try to manage patients who have male infertility together with their counterparts.
Yeah.
I think, my patients can attest that I always ask them, kindly come in with your wife so that we can also discuss this, It might also not be easy for a man to disclose to the woman that I might be the primary cause of us not getting a child. Again, remember Joan Thatcher's story where this woman had 3 children that were not for the man. So it might not be easy, and maybe the wife or the partner knows that she's not the problem. And even when she tries to address it to the man that you might be the problem, he does not take that quite kindly. So I always advise him, kindly come in with your wife. The first consult, come in by yourself. Let us go through it. Let us try to understand. And then the second or the third, come in with your wife so that we discuss your results and start that
through the journey together.
Yes. And even, let me know your gynae, the one who is managing your wife, so that we can have a conversation about how we can manage you as a couple.
Yeah. And what is the difference between infertility and impotence? I know.
Hey, Amanda, you really want me to bring out my andrology today? So,
yes.
Infertility, you cannot become fertile.
Yes.
You cannot conceive after having unprotected, regular sex for at least 12 months.
Yes.
Impotent. Hawezi gurumisha? Chonyonyo haifanyi kazi, hata ukijaribu aje. So that is imelala. Exactly. So that is impotent. So there's a difference. There are patients who suffer, more patients suffer from what you're calling impotence, which is actually erectile dysfunction, and than male infertility. So erectile dysfunction is a whole other can of worms that has its risk factors, but it will also affect the fertility of our patient, because if you cannot get it up, then how are you going to conceive? That now will lead us to doing, well, the IVF, like
Yes.
extracting your sperm, considering that it would be there.
Okay.
Yeah, yeah.
So for them, they can do the IVF.
Yes, they can.
Okay. And what are the main causes? Like, from there are some who might be impotent. How do mothers can check on their little ones
Wow.
at an early age?
Actually, Amanda, I am a mother to boys, so I can tell you I walk through this journey every day with them.
Yeah.
So, well, there are developmental stages or milestones in children.
Okay.
So there's a stage which we call, there's an oral stage, and that's a stage where your child is always putting things in the mouth. There's an anal stage where the child is, well, pooping and learning that there's something that's coming out of my bum bum. And then there's what we call a phallic stage where the child is engrossed in their penis.
Okay.
Now, for mothers or for fathers too, a child is allowed to get an erection. It might not be strong, it might not be a long one, like for a long duration, but a baby boy will get an erection.
From which months or weeks?
Weeks.
Oh.
Yes, you can just see, especially when they're peeing in the morning, you'll just, peeing anytime really. They don't quite, that's why boys don't quite shoot like that.
Yeah.
Like they just don't pee like this. They're always shooting like that.
Yes.
So that is an erection. So now you'll find some parents are like, he doesn't get an erection, just doesn't stand. Then you'll be able to tell it more at around 3 years of age, because that's the phallic stage.
Okay.
So that's when they get erection and they realize that, I'm having a penis and it's getting aroused. I know it's a really sensitive topic for people to think that their children might actually be getting erections, but it happens.
Yeah.
And then the other thing is when you have a baby with a really small penis, like this small,
Tiny.
really tiny. That could be a problem, and that would need to be investigated further, And then another thing that people also, don't know about is that there are people who look male, but inside they are female.
Okay.
Yes.
Expand.
And no, it's not the gays. I'm not talking about gay people. When one is born, I don't know if you know this, but you can't be born looking like a boy, but inside maybe you have ovaries, and therefore doctors choose that you're going to be a female because you have ovaries. So again, it's a really funny concept, but females have a penile lookalike, which is the clitoral body. So it's just that for men, it elongates. For a baby boy, during formation, as when they are a baby, it elongates to form the penis, but in women, it remains small, and it's what is called the clitoral body. So sometimes you find that they are girls who have a really long clitoral body. That again is the domain of pediatric surgeons, where they do the surgery once they find out that you are genetically a female. So now for those ones, again, women need to just see how is the scrotum of my baby born? Are there testes inside there, or they are not? If they are not, and the sexual organ looks like for a girl, then we'll investigate you further and find out if your baby boy is actually a baby girl.
Okay.
For boys looking like girls, not often, as girls looking like boys. It's easier that way, again.
Okay.
Yeah.
Wow. And then for the small penis, at which month or age can the parent know that it is tiny, or maybe through the pediatrician when they check the baby?
When they examine. And then there are also boys who have what is called a buried penis. So your section is so huge, and then the penis is really small. Again, domain of pediatric surgeons, they're the ones who correct that earlier on.
Okay.
Yeah, in that time. But I think even like from birth, you should be able to tell that your baby has a yes, because children are born with really huge scrotum, and then it shrivels up as they become older, and then when you're really, really old, your scrotum again starts hanging. But you should be able to tell.
Okay.
Yeah.
Okay. Wow. And then for the aged people, impotence can come along the way.
Yes.
What are the main causes of that?
Main causes of male infertility. The one that I like addressing the most is look at our lifestyle. We have people who work in really distant areas, and therefore they have to wake up early to be able to make it to work early enough, meaning they don't put in good hours of sleep, they don't rest. Yeah. They do not exercise. What is their diet? If they need to get to work and let's say it's in town, what are they having for breakfast? What are they having for chips? It will be for lunch. It will be fast food, so the diet is poor. By the time they're leaving work at 5 o'clock, they don't want to be stuck in traffic. So what do they decide? They decide, oh, let me just pop up at my local. Let me have choma, again, all the fat. Let us have chips maybe, or ugali skuma, whichever way you plan to look at it. They're like, okay, Santa kunywa soda the whole time. Okay, even soda is not good. But will they drink water? No. Will they drink soda? They're like, hey, wacha niongeze hapa kamyeso. So then now they take alcohol. And again, if let's say they are social smokers, they smoke. So they would end up leaving the local, maybe let's say at 10, so that they can go home when there's no traffic. And then they sleep for very few hours. I think I've addressed all sorts of male infertility. Our lifestyle is terrible. When you're obese, when your diet is poor, when you do not exercise, when you smoke, when you take alcohol, all those are risk factors for having erectile dysfunction. And if you have erectile dysfunction, really, it also makes it hard for you to have good penetrative sex with your partner, which will enable you to conceive.
Yes.
Yeah.
And can stress also cause that?
Yes.
A lot.
And then also, I there's something, again, I tell you, this is usually the longest clerkship. I will take even an hour with a patient just trying to find out what exactly is happening.
Yes.
There's something also called situational, meaning you find someone says, when I'm with my wife, I cannot get it up. But the minute I see Jerry from the office, so you see that is situational. For men, sex is really here.
The mind.
So it's for women, but we don't activate our whole chain as fast as men do. So it's in the mind and it's really visual, And I think that's why women are always told, oh, don't dress up in that, Kimbo t-shirt, Mara, you're fungad yourself looking like a healed woman, So it's really vision and then stress. You can imagine if, let's say, a man has lost his job, how is he going to fend for his family? All these things he has at the back of the mind. So he cannot even, get it up. Yeah.
Okay.
So that would cause it. And
but
sex
now
would
the
be
situational, it means there is something that happening in the family, as a couple, that is turning him off.
Yes.
Okay.
Yeah.
So to the wives,
what would I tell them?
When that's such kind of cases arises in the family, what can they do?
Again, the first flagship or consultation I will have with you, even the second one. The third one, let your wife come in, because by the time you have ED and you've come forward, she has probably also noticed. And maybe she has also been complaining. I always ask them, is your wife complaining about it? Some go like, well, yeah, she is. Or maybe you don't think that she is, but it's also affecting her. And then women are really used to carrying the entire society on their shoulder.
Yes.
So when that happens, she'll always ask herself, ni nini na baba nani? Why, mbona siku hizi? Is it something I'm doing? Should I make for him that special chicken of his? You know? So it's something that maybe they can address. Sometimes in life, as I said, we really work hard, especially actually with our taxes as Kenyans. We are really suffering.
Don't worry, we'll overcome.
Actually, we are really being taxed. So the little money that you made earlier on has now just been reduced drastically because of the increased taxes.
Yeah.
So he has that to think about. Yeah. And then also on the other side of the things which can be causing stress in a marital is when you have children.
Yeah.
Okay, especially when you have, I don't know, CBC going children. You have homework to do with them.
Yeah.
By the time you're done, you have to plan for tomorrow. As in, what time do you get as a couple, to couple, to just, fall,
have that quality
to
time.
be intimate with each other, to remember why you fell in love in the first place.
Yes.
So I would say the family unit is under attack, but again, we shall overcome.
Yes.
So I always encourage the clients who are also struggling, both with, ED, erectile dysfunction, and also male infertility, try to get away, switch off. Hata kama utalipia zile holidays, I don't know, za kwenda tu hapa one day,
yes.
Even go for a staycation, try to rekindle your love and see what magic it would work. Yeah.
Yes.
There's this, very famous Tanzanian musician who said, usitupe big G, Wanjiru yes, kuonjeshwa. So same concept, try to see, is it working? Is it not working? What can we address as a couple? How can we spice up our bedroom matters? Because the bedroom does matter.
True. True.
Yeah.
And if can masturbation cause impotence?
Masturbation can cause erectile dysfunction, which can, as a chain effect, also now cause the male infertility. But yes, masturbation highly discouraged.
Okay.
Highly discouraged because, if it's not visual for men, the next thing is tactile. So if you wear out your tactile sensation, then it will be really discouraging even to your wife or to your partner, that when you guys should be getting it on, you have to, stroke it a bit. So masturbation is highly discouraged, and studies have shown that it does affect your erectile dysfunction.
Okay. And what about diabetics?
High up in the list, yes.
Number one.
Yes. Again, actually, that is one of the way. The diabetes and high cholesterol levels.
Okay.
That is one, and hypertension too. That is one of the ways that we diagnose diabetes. It's by them presenting with erectile dysfunction.
Okay. Wow. So, okay. It is becoming tense.
It is.
Yeah.
Things are getting worse.
I know. So, what kind of remedy, like maybe for the aged ones? Because there are some who might have children, but in the long run they can't have because of that ED. So what are the chances of them becoming again productive?
Actually, you'd be surprised because we do manage patients who have also, prostate cancer, and the medication that we start them off on also affects, their libido or their sexual function. So you'd be surprised when an 80-year-old man, after the consultation of something totally different, tells you, hey, Dagetari, there's something or there's nothing that's happening and I'd like you to address it. So men are really virility, potent, the opposite of impotent. They're really virile, even in their old age. And that's because, their testosterone levels kind of, maintain it and then slowly start decreasing when they're really, really old. So then now in those patients who have, children and they would still like to sire more children, it's still very possible unless, we have other issues that are coming up. If it is about the erectile dysfunction, we have management for that. There's also non-medical management where we ask the patients to exercise, eat a very healthy diet.
Yeah.
And then the other thing is if it is post-surgical, like as a complication of post-surgery, like if you've had a radical, and the underlying radical prostatectomy, which we do when you're having prostate cancer.
Okay.
If let's say you have a surgery called TRP, in which one of the side effects is that you have your semen going back up into your bladder, it's salvageable because you will pee out the sperm, and we will be able to, filter it and perform IVF in those patients. It could be medically induced. There are some antihypertensives, diabetic medication, that affect how we engage sexually, or how men engage sexually. So then for those men, they still hope.
They still
hope.
You should not give up.
You should not give up. And just always be willing to walk the journey with your spouse, plus also your doctor. Come clean, say, doc, this is what we are trying to do. Come in for the consults, come in for the reviews, because I can't just see you once. The tests are really expensive, especially when I'm trying to diagnose, male infertility. The simplest, as I've told you, is usually a semen analysis. It's cheap, it's available, but please do it in reputable labs. It's very important that you do. You have to abstain for 3 days prior to giving your sample, so that at least when we are getting a reading, we know that this is how things look like. This is how things are on the ground.
Okay.
If that comes back up normal, then now we switch up to your hormonal test. We will check your testosterone. Testosterone is also produced by the testes. So we want to make sure that your testes, if it's just not producing sperm, maybe it's still functioning by producing testosterone, the hormone. If it's not producing testosterone, which is a hormone that makes men feel like men and be very different from women, we now go up the ladder and we check whether you're producing some other hormones. One is called LH, the other one is called FSH. They're the ones that stimulate the testes to work. If those are normal or if those are abnormal, we go up again. We started from down here in your scrotum. We went here somewhere called the adrenal glands. If that is not working, we go to your thyroid and another hormone producing gland in the brain called the pituitary and the hypothyroid. So these tests cumulatively will probably cost maybe we're thinking of 40,000. So you see, it's not something that we would just tick, and insurance doesn't cover this. You need to know insurance. This is self-paying cash, So then we take our patients slowly. We start with this test. If this is abnormal, let's do this. So it's a journey that you should always be willing to walk with your clinician.
Okay.
Yeah.
And what causes dry spell?
Again, it's mind. It's mind. What is even a dry spell? It's just when you're not having sex. Again, if your mind is not in it, then your body just can't function. For women, it's a totally different thing, which I think I'd prefer the gynaes to address, because getting a woman in the space can be really, really hard. And again, she doesn't switch on and switch off as easily as men. So women do tend to suffer when it comes to that. Men, not so much. Again, for men, there's medication to treat it. For women, there's no medication to treat it, really. We just try to, maintain a good environment, give you vitamins, supplements here and there. But for men, there's medication that will actually be able to stimulate you.
Oh.
Yeah.
Not the Viagra.
That one.
Is there another one?
Just cousins, which are safer cousins.
Because some, maybe some it doesn't work for them, or maybe even drives them crazy or something.
They just safe use in using the medication. Viagra is what we call sildenafil. Viagra is actually a patented brand name. So sildenafil is the mother of all medication, which was stumbled upon when people were trying to treat heart issue. So then they were giving people the medication for the heart issue, and then they realized, you guys are really getting good erections. Then that's when they're like, thing. We can actually maximize on this and profit from this and use it for erectile dysfunction instead.
Oh.
So then with time, it has had, well, people are not using it well. Let me be clear about that. People are not using it well. There's something that I like to educate my patients on. If you're going to use it, if it's going to be sildenafil, you have to use it right. It's not an everyday medication. You have to use it 30 minutes before. There are safer cousins to it.
Okay.
Yes, people sat down in the labs, men love themselves, and they're like, oh, if this one's not safest, then we are going to come up with others. Yeah, so there are safer ones, which people, and I put my patients on, everyday dosage.
Okay.
It's an everyday, it's a low dose, and if that doesn't work, we switch up the medication. You know, it's just something that you need to keep on coming and saying, this is working for me or this is not working for me. Yeah.
Wow. So people should not really...
Don't use it OTC, over the counter. That's bad, because then you won't even be able to address the root cause of why you're having erectile dysfunction. You know, and by the time you're coming after, let's say, 2 years of using it, it's a whole mess that you're trying to clear out.
Wow.
Yeah.
Treatment over the counter.
Not advised.
We like it so much.
Not advised. Not advised.
Okay, so for the IVF, the chances of, I know we addressed this with the gyna last time. Yeah. The chances of the male, if the semen are not really, sometimes when they are watery, what are the chances of them impregnating
another lady? It depends. You know, per every ejaculate we produce what? 1.5 million per ml, multiply that. It's like 45 million sperm. 45 million, and it's only one that is needed. Yeah, so there are people who have low sperm count. For those ones, we manage them for at least 3 months with some medication, trying to provide a good environment for the sperm to form. And then we repeat the semen analysis after 3 months. We try to see if there's improvement or not. There are those ones who have zero sperm, or even the initial one. Again, we try to give them medication. We repeat it after 3 months. We try to see if there's anything that has been produced. If nothing has been produced, then it could be obstructive. Remember, through that tube that's called the vas. So if that's the problem, then there's a way that we get sperm direct from the testis. We aspirate it, and then now that's when we do the IVF, in vitro fertilization. So we might aspirate or we might remove sperm from the testes, and then we find then either there's no sperm or we have really unhealthy sperm that can't fertilize anything. And again, that is a really challenging topic or journey to even work with your client, you know, when there's nothing much that can be done because you're either not producing sperm or they are completely unhealthy.
So what is the route, like not even producing sperms, like how?
Remember, if let's say in your childhood you did not your testes did not descend, you did not provide a good environment for your sperm to be produced, therefore you find you have zero.
So it's something that you grow up with.
Yes.
And then you come
can't
to
grow
realize.
up with. The other thing is, if you have trauma, again, guys, there's something called testicular torsion. When your testis twists upon itself and there's no blood supply, therefore it ends up dying.
Wow.
If it dies, then your future fertility is really reduced.
So dead.
Good thing is that we have 2 testes. God was really kind, so we really have to take care of the other testes, because hiyo ndio imebeba tena. But
so one can be magical.
Yes, no, one of them always comes through. By the way, with time, even when we've done the surgery and let's say we've removed a testis that had died, the other one really steps up. It even becomes bigger. It produces more. It puts in work.
Okay.
Yeah. So another thing about mothers to boys, especially the ones who are in boarding school, adolescents, teenagers, even at to around 30 years. So there's something called testicular torsion. Um, Let it not be addressed in school and even to the children. Like, just always have an open conversation with them that if they have any pain down there, they can come to you as a parent
Yes.
and address it, and you'll address it immediately. Because again, I have clients who waited a bit too long, and maybe they shrugged it off and thought, what is he saying, or the pain will go. Or if you're in a boarding school, the school nurse decides utapatiwa antibiotic and painkillers, and at that time there's no blood supply going, that will affect it. So then that will only remain with one test, but it will work. It's not so bad.
Yeah, but it is bad for the child because it's also psychological.
It is
Yeah,
to
when
know
you
that
are
you
with
only
your
have
friends and they see like, hey, why do you have one?
yes, it is.
Yeah, so the mothers, as parents,
Mm-hmm.
they should really check on the formation of their children as young as the day they were
The day
born,
they're born.
and
The day they're born.
continuously check.
Oh yes.
Okay.
And that's why, again, when you're delivering, it's really good to have a pediatrician who's next to your gynae when you're delivering, because gynae will remain on you,
Yes.
finish with you, you've delivered, whether it's by SVD or whether it's by CS. After that, then it becomes a pediatrician to even check. There are patients who do not cry at birth.
Yeah.
There are patients who you can be able to pick out small things that will affect them eventually in life.
Okay.
Yeah. If, let's say, you did not cry at birth, and then there was no blood supply to a very specific part in the brain, that means your hormonal, remember the hormones I mentioned in the brain,
Yes.
won't be produced. So then now in future, even your sexual life will be affected. So it all starts from how you were born, your birth. Were you born at term, 9 months? Did the baby cry? How many kilos was the baby? Were there any infections postnatally that could have, child affected the baby? So all this, it starts from back there.
Okay. So we should not be ignorant
No.
from the beginning.
Yes.
Wow. And sometimes you find that there's children who have been molested. Can that affect also their
Sexual assault in both boys and girls? It really affects how they view sex. Yeah, so they will not be looking like they would need counseling. Even in future, you might find they really shy off from having sex because their initial encounter was not a healthy encounter, and therefore even them getting an erection is hard. They do not quite understand how it should be. Again, also in the ladies who have undergone the FGM, sex to them is totally different. There are different stages of FGM.
Okay.
So when I say penetrative, you do find that there are some who, after the cutting, the mutilation, it healed and blocked completely.
Oh.
So then, in that time, this is a girl who has not been exposed to sex, does not know what sex is, has been married off to a seemingly also young Muslim counterpart, and they are now trying to have sex, and it's not penetrative. And for them, it's like they're always on a clock. You've got married, we expect children within 1 year.
Yes.
So then I always ask them to first come, I examine the lady, and I see, was she undergo the FGM? How is her genitalia? Is it normal? Is she able to get penetrative sex? Oh, another thing, I'm sorry, I forgot to tell you. This penis, that sometimes that it's curved. And that curvature is not a good curvature. Penis that ideally should be straight and maybe with just a slight curve. This, not good. That, I don't know, I cannot, but also not good, because then how are you going to penetrate a girl if you're
When
having
it
such
is
a curved? Yes, so that is also a risk factor for
For the men.
male infertility. Yes, it becomes hard to penetrate a girl. Yeah.
So for the ladies who are those who underwent the
FGM.
AFGM, and if it is blocked, is there a way to correct it?
Reconstructive gynecologist.
Wow.
There's one, she does what? Is it clitoroplasty? Plastic surgeons also do a lot. And there's actually a colleague of mine, she's called Nahia. She runs, a project for trying to reconstruct female genitalia for patients who have undergone FGM. Because again, the sex is usually really painful. So if you're having painful sex, you are not looking forward to having sex, and therefore you will never quite be able to conceive.
Yeah. Okay. Wow, that was
A lot. You have taken me through my entire andrology. You brought me from male infertility. You've taken me to erectile dysfunction. You brought in a bit of pediatrics.
Yes.
Yeah.
Parents have to know.
They do.
Those who are raising male, so you have to know. You have to be aware of the situation you are handling.
Boy child is in.
Yeah, the boy child, because they have been forgotten.
Yes.
Yeah, we always talk about women,
the girl child.
Infertility, women. We forget that even
males,
the men.
it's a 50-50 thing.
Exactly.
It's either the man or the woman who's contributing.
Yes. Yeah. So I think this was very educative.
Okay.
And if someone wants to contact you or to come to your clinic.
Oh, wow. Okay. So I have two offices really. One is at Nairobi in it's called 40 Suits, the 8th floor, suite 8 or 9.
Yes.
Or Mirazi. It's an office, it's a medical co-sharing space. And the other office is also in Thika. So Pushpa Plaza, 3rd floor, office D1. My office number is 0742 390 322. But you can also get me on email at uro-surgeclinic@gmail.com. I'll be more than willing to take any of the patients or any of my clients through what we have to do. Yeah, so let's tackle this together, really.
Okay.
Yeah.
Thank you so much, Dr.
Thank you, Amanda. You've really been nice and extremely patient,
Thank you. Actually, I should just say thanks to you for giving me this opportunity, even just to share with the audience. And the series that we are talking about is about the weight, the pain, and the healing.
Oh, wow.
Yes, about the couples who have been struggling to conceive. Yes, and so we have talked with the gyna, and now we have talked with a urologist.
Yeah,
and I know they are packaged to continue the journey as we trust God for babies.
Yes.
Yeah. So thank you guys. It was really nice. I hope you have taken something home, and the urologist is available. You can reach out to her. And please, our men, we love you so much. We care about you. Please don't just stay where you are. Seek help. Seek medical help. It goes hand in hand. And also, as you work with your spouse, I know God is going to do something for you. So please continue to subscribe, like, and share, and comment on this channel. See you next time.
Thank you.
Thank you.
Thank you so much.